Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left 4, 5, 6, and 7 region for implant placement. On the panoramic view, you can see that these are in the edentulous area, and here we can show you that the lower left 4 is root canal treated but has a major periapical radiolucency and bone loss around it. On the transaxial view, which is the proximal view, you can see that there is buccal bone loss and radiolucency around it. So we would advise extraction and immediate implant is going to be slightly complicated due to the nature of the bone loss around it. But we will still measure the area where the bone loss can be seen. So we've got a 7.8 millimeters of ridge width with approximately 13 millimeters of ridge height, but the width is much lower in the middle region. When we move to the second premolar region, here you can appreciate that the ridge is quite narrow. We've got 4.1 millimeters of ridge width at the crest, and we've got approximately a good 6.7 millimeters of ridge width in the middle, and we've got 15 millimeters of ridge height. Moving to the first molar region, here again the bone is quite significantly thin, 5.2 millimeters of ridge width with approximately 13 millimeters of ridge height. In the second molar region, where we've got the most adequate bone type, we've got 6.3 millimeters of ridge width with a good 14.8 millimeters of ridge height. Now these are the dimensions we've told you. The bone quality in this region is D2, as we've got good cortical and good cancellous bone. Now moving to implant placement, we've been told that Korean implants will be placed with generic Neobiotech. Just to give you an idea, a 0.3 mm less of implant diameter if used in each area would yield significantly better results. Now here we have placed 3 implants for our doctor. As you can see, these 3 implants have been placed. The yellow portion indicates the prosthetic component. This is how they look on the panoramic view. Again, this depends on the exact type of implant being placed, but to give you an idea, this is the distal most 7 region. You can see we've got adequate bone. This is a 4.310 mm implant that is placed here. It's got good quality bone around it, and it has good bone support. Moving to the implant in the first molar region, here the ridge gets significantly thin. So even though we've used a 4.3, a 4.0 implant used here is going to yield significantly better results. If we use a 3.8 mm implant in this region, so even then the results might be slightly improved, as you can see right here. When we use a narrower implant in this region, so we'll have better results. Moving to the lower left 5 region, or the second premolar region, here we've used a 3.8 mm implant, as you can see, because of the thin ridge. But even if this is placed 2 millimeters below the crest, so there will be adequate bone support for the implant to integrate and to have a good longevity. So if there are any further questions regarding this case, please feel free to reach to our team. Just to give you an idea, these are the 3 implants placed quite center of the ridge for better understanding. If we look quite superficially, so they are placed quite center of the ridge, even though the ridge was quite significantly thin in this region. But as you move down, you can see that they will have good bone support at each point. If there are any further questions, please feel free to reach to our team. Thank you very much.